Basically, leukemia is a type of blood cancer. And what leukemia means is finding of an abnormal cancerous white cell in the blood when someone looks at it under the microscope. Now, the leukemias are mainly of two types. You can get a chronic leukemia and you can get an acute leukemia, out of which the acute leukemia is a little bit more life-threatening and needs urgent treatment. The chronic leukemias are usually indolent, but they can turn a bit aggressive. But at the end of the day, there's treatment for both. So, as I explained, there are two main varieties. You've got a chronic leukemia and you've got acute leukemias. Acute leukemias are rapidly growing, they're rapidly progressive, and therefore symptoms come on quite rapidly. So, the symptoms are basically, a function of the underlying bone marrow and what lineage of the bone marrow is reduced. So, for example, when the cells grow abnormally within the bone marrow, they crowd out the normal cells. So, your red cells tend to go down, the platelets tend to go down, and that is reflected into the symptoms. So, because of low hemoglobin, people may feel tired, they may feel fatigued, they may feel short of breath. If the platelets are low, then they can find themselves to be bruising very easily, they may be gum bleeding. And when the white count is very high, sometimes then there is some shortness of breath, or the immunity function or protection from infection goes down. So they find themselves to be having infections which are quite recurrent. So those are some of the symptoms of acute leukemia. On the other hand, if you look at chronic leukemias or the chronic lymphocytic leukemias, we tend to see the patients present with high counts, but they usually don't have that many symptoms. But sometimes they can present with, lymph glands or swelling or neck nodes in the groin or on the arms or in the neck, which are usually painless. And as time progresses, they may find that those swellings or those nodes in the neck or swelling in the neck, those can increase over time. So they can present with a variety of signs and symptoms. When any of these leukemic patients come to a doctor, I think the first thing that we do is a general physical examination. So after taking a full history. So on the examination, we look at, obviously what we saw, what we said before. So is there any bruising over the skin, any evidence of gum bleeds? Does the patient look pale? We examine the abdomen mainly for splenomegaly and hepatomegaly, which means enlargement of the liver and spleen. We examine for lymph nodes under the arm, in the groin, and in the neck. So we look at all of these things as part of the examination. Then the second part which is most important, is just a complete blood count or a CBC or a full blood count, which will tell us what's happening to the hemoglobin, what's happening to the platelets, what is happening to the WBC count. And in addition, what we do is a blood film. So we look at the blood under the microscope, which will tell us what particular cell or which particular cell is looking abnormal. Then we have to confirm the diagnosis. We do a specialized test called a flow cytometry. Flow cytometry is nothing but it's a very highly specialized technique whereby it can detect specific cells. And what I mean by that is that each cell has got, consider that each cell has got a flag. The cytometer tends to identify these various flags by having antibodies against those flags. So when we have got a combination of these flags together, we can actually categorize them into one or the other. So that is how we can say that this is myeloid or this is lymphoid, whether this is acute, whether this is chronic. So flow cytometry forms a very important basis. The second thing that we do is some genetic tests. So for example, in chronic myeloid leukemia, there is a defect between chromosome 9 and 22, and it forms a specific protein which we call a BCR-ABL. So there's a blood test that we can do to detect this abnormal, protein in the blood, which will sort of confirm whether the person has got chronic myeloid leukemia or not. In most instances, for example, in acute leukemias, at least we tend to do a bone marrow test, because we actually need to look into the bone marrow to see what the blast percentage is, or the abnormal cells, which we call leukemic cells. Essentially, when we say acute leukemia, there are certain cells called blast cells. Normally within the bone marrow, they are usually less than 5%. But when they increase more than 20% in the bone marrow, we say that this is an acute leukemia. So bone marrow is part of the examination. In addition, we send additional tests mainly for prognostication and risk assessment. So we send some genetic tests to look at the chromosome and chromosomal abnormalities. We send some tests from the bone marrow again to look at certain mutations, which will sort of inform us to see what the risk of that particular disease is and whether there are any more treatments that we could offer these people. In some instances, like chronic lymphocytic leukemias, we may even add a CT scan or some scans to see if there are any nodal enlargements or whether there are any masses in the chest in acute lymphoblastic leukemias. So we make use of these other scans as well. So all in all, it starts with a general examination, ends up with more specialized tests.